You're listening to the Autism Weekly podcast. Each week we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Janie Funk, who's the clinical director at Behaven Kids, overseeing the ABA programs and services across all locations. Dr. Funk brings over a decade of experience in providing services for individuals with neurodevelopmental disabilities and other related disabilities. Dr. Funk's contributions are pivotal in expanding Behaven Kids' reach to support more families in Nebraska. Her commitment lies in not just maintaining, but elevating the quality of behavioral health services through her leadership in building clinical teams and developing effective systems. Join us as Dr. Funk shares her knowledge into ABA therapy, parenting strategies for children with autism, and her vision for the future of Behaving Kids. Welcome to the podcast, Dr. Janie Funk.
Thanks so much for having me. I'm excited to talk with you.
Well, all of these topics are ones that I love to be able to get into and to be able to kind of talk and really understand how each one of these pieces are pivotal for the success of the other. But before we get there, I'd love for our audience to get to know you and know why you got into the field of autism and ABA specifically. So what sparked your interest?
Sure, it's a great question, one I like to reflect on every once in a while. It's good to reflect and be grounded in your values and your mission at a personal and professional level. So I was thinking about this in my path and journey. It's both personal and professionally influenced. I was most interested in mental health and developmental disabilities in children more generally before I learned more about autism and leaned into that subdomain of behavioral health. And that started in my late teens in just exposure to other people with neurodevelopmental disabilities and conditions. So from there, I went to undergrad in Kansas at McPherson College and got a degree in specialization in psychology and child development. So through that degree and specialization, I learned a lot about the various neurodevelopmental conditions and related conditions, and much more about autism at that point. And when I chose to go to graduate school and pursue further education, it was certainly with the objective to serve the communities who are impacted in various ways by neurodevelopmental disabilities and related conditions, and found myself in a behavior analysis program where I learned about the technologies of the sciences, and that's what we refer to as ABA. And then in my clinical training, I actually specialized in adults with intellectual and developmental disabilities. So I have many years of experience working in the adult sector, where I was serving adults with complex health needs and complex developmental histories and presenting challenges on multidisciplinary teams, and learned a lot about the variation of what people's trajectory can be throughout life with early intervention or a lack thereof. And that's where my passion for serving kids is, youth and their family right now, is that I've seen, what is likely to happen if they are not well supported at an early age. So that's a bit about the progression of my interest and where I'm at now with my mission to serve these communities. And it's certainly with an overreaching objective of improving quality of life for those individuals.
Now, your background, the way that you were able to kind of walk us through that is that you have a lot of pieces to it. I mean, you've looked at the development of children all the way through adolescence and young adulthood. You've seen the mental health and behavioral health side of the field, and you've incorporated early intervention and ABA throughout the lifespan. That to me is the well-rounded picture of, what a clinician should be able to really understand if they're going to impact the family and the development of a child. What is it that's unique about the program that you're creating here at Behaven, where you're really trying to integrate all of these components? Because you see a lot of ABA programs where it's very isolated and I'm going to do just this one thing, but you've broadened your practice. So what's the philosophy behind that?
The philosophy is really in service of the youth and the families who are being served. And it's inappropriate to think that one specific modality will be what is the one and only component of an individual's life that will make the meaningful impact. It's really consideration of the individuals who we serve as whole humans and with a variety of needs. And to think that behavior analysis is going to address all of their needs is not correct. So it's really in the spirit of collaboration amongst other professionals and stakeholders who are situated to be able to contribute to improved quality of life for the child and their family or caretakers, in the spirit of acknowledging and recognizing and respecting that there are scopes to our practice and limitations to our individual practices and professions, and that it's in service of the child and their family that we keep that in mind and approach our engagement accordingly, with collaboration and engagement with other people who could serve, fill in the gaps that we can't. So it's really in the spirit of that. This is a child who has a whole life. Quality of life has many different aspects, and we can certainly, as behavior analysts, contribute to those indicators of quality of life, but we're not the sole service that these child need, just like any other profession. It's speech therapy or psychotropic medication. That's not going to be the one and only therapy that someone receives and is good to go for the rest of their life.
Yeah, that makes a lot of sense. And then even as you're talking about quality of life, you initially had spoken about, the value of being able to start to interject therapy or interject treatment resources early in one's development. And I think I've seen this, is that it gets more complex. It gets more complicated the longer you wait. And it's not like a social emotional behavioral disorder where maybe there's a critical incident that has occurred in one's life. When you have developmental delays, is that this starts to compound over time. The less that you're able to really focus on getting those skills early in one's life. So what's the best process for a family to really start to seek out and to assure that, I'm giving my child the best chance early to figure out what is the right treatment, but also to understand my child a little bit better through the diagnostic process all the way through finding the right provider?
Wow, what amazing questions. Those are so important. The diagnostic process is not especially accessible to everybody in our communities, and that's a whole separate conversation. But I would start with, just more generally, if you are a parent or if you engage with children, it's really helpful to have an understanding of the development of children generally. What are the milestones, and at what point should you really typically start seeing progress in that area towards that milestone? So one of the resources that I recommend all the time is actually a program through CDC called Learn the Signs, Act Early, I believe. Learn the Signs, Act Early. and it's through the CDC. If you just Google CDC, learn the science, it'll pull right up. But the site has so many great resources for learning about and tracking a child's progress on the developmental milestones, and provides some information, a lot of great psychoeducation around developmental delays, what to look for, what to keep an eye out for, at what point might you want to seek consultation from your pediatrician or even a specialist if you're seeing any sort of delay, if you're not seeing something on the milestone chart. So I really love that resource. They also have an app that you can download, and that's more limited to just tracking the milestones and your child's progress through the milestones. But if you go online, they have so many resources for just educating generally about child development and different resources that might be relevant to your child's development. And you might notice that there's a delay in certain aspects, and it doesn't necessarily mean you'll end up with an autism diagnosis or any diagnosis really. But if you think about a public health model, which I'm a huge proponent of, prevention and resources early on is just critical for the trajectory of an individual. And so even if it's not your concerns or what you're seeing isn't to the level of a diagnostic criteria, having some additional supports in that time period for your child or your family can be really critical to further, success and thriving as an individual and as a family unit. So,
Absolutely.
Yeah, and you asked about a lot of important components. So, let me know if I miss anything, but
No.
also finding a provider is really important as well, and also not so easy, but being able to find a provider that meets the specific needs of your child, but also that is going to approach in their therapies, their specific domain of professionalism, their approach needs to align with your and your child's objectives. They need to align in philosophy, and there's a lot of talk about various therapies diminishing the uniqueness of a child and quote unquote normalizing them and discounting and disregarding the actual experience of an individual with a disability. The autistic community is very informative on this aspect. Absolutely. But being sure that your provider is in alignment with the goals that you have for your child, and if your child can communicate their goals, obviously their input's important as well.
Yeah, and I often find that more of a provider skill set, because when I look at a lot of the treatments and therapies out there, is that the therapy inherently shouldn't be doing that. The provider's allocation or implementation of that therapy is probably the one that's leading to a little bit more of this friction. But you had mentioned utilizing that CDC tool, and there's so many states out there that don't require a diagnosis to start early intervention, to start the getting the opportunities for your child for empowerment early. And I think that what you said is so crucial, is just giving those tools back to the family is so important. One of those treatments is what you actually finished out and probably, I think, got your doctorate kind of focusing on, was ABA. And I'd love to talk about some of those misconceptions of ABA, because you had commented on the fact that oftentimes people are saying it's about normalizing, it's about not being attuned with the fact that uniqueness is a positive, and that we should be celebrating that as much as being able to empower the individuals. So I'd love to hear what are some of those misconceptions, and with the appropriate application of ABA services and bringing in caretakers, kind of making sure that you're keeping the communication and that you're engaging everybody in decision making throughout the process. Is there really an inherent flaw in any of those treatments, or is it really kind of what I was suggesting earlier, where there's more of the practitioner flaw, not necessarily the treatment flaw?
Such great considerations. I really appreciate that you bring that up. Even if we think of the medical field, and there's not much disregard widespread of the impact that the medical field can have, and people do take a lot of care to go consultation and oversight and evaluation from their primary care physician. But if you think about the history of that field and what has progressed as best practice over time in that field, there's a notable history with that profession as well. I mean, if you think about uh, their involvement in caring for people with disabilities, even or mental health challenges, and the interventions that were used with those populations, it's notable, and it's not unique to any specific field. In my opinion, there's certainly risk of improper or harmful or inappropriate application of the science, and that should definitely be on the radar of any family member, caretaker, individual who's seeking services from any profession. So I do appreciate you bringing that up, and it's helpful to remember the history of our various sciences that we hold with respect today. ABA is certainly a younger field relative to some other professions, and that said, there's still a lot of evidence supporting the science. It's an evidence-based therapy, ABA is. And so I think there is an important distinction there, is that, you know, there are a lot of different options that families have in the community, and some are regarded as scientific or evidence-based and others are not. But I would say there's certainly a consideration of pseudoscience, and if you're seeking something that is evidence-based, that's important. I certainly would not want personally, I would not want my health and well-being and being addressed and supported by something not backed in any sort of science or evidence. So there is that, and then also certainly a consideration of the application of the science of that existing evidence base. So there's notable history of the field of behavior analysis and how our treatments and technologies have evolved over time. I'm really proud, though, to be a part of a field that has, from its inception, really, ABA has been focused on quality of life and what is functional to the individual. So I think those foundational values and mission of our field and our practitioners is really important to keep in mind as well. So that's one thing that I'm very proud about, is that, you know, despite the history of ABA that involved use of harmful, according to some who were impacted by it, and other uncomfortable interventions or therapies, it was at, you know, it's relative. So at the time in the 60s, for example, it was very common for people with disabilities to be institutionalized, and in that kind of setting, there are a lot of restrictions. There's restrictions on what that individual can do, who they see, who their caretakers are, restrictions on their health care providers, community engagement, ability to financially support themselves, communication, a lot of psychotropic and pharmacology interventions and restrictions. So if you keep that in mind, and then remember that the field of ABA was really there and present and supporting individuals with disabilities towards lessened restrictions, I think, you know, I'm proud of that. And where we've come as a field now is we're doing a lot to do better. And I think that's important, is your best practice should be evolving in any field, but we're really approaching our services and our contributions as a component of what could be helpful for an individual, and being very careful and mindful to include all stakeholders and engage in person-centered planning and assent-based care, and doing so with compassion and rooted in quality of life for who we serve, and not to attempt to diminish the uniqueness or individual characteristics that make a person who we are for the convenience of others.
Yeah.
So, it's very function oriented for the individual. How can we functionally support them? What are the functional skills that we can help them learn towards improved quality of life?
Absolutely. And I mean, when you look at just even culture over that series of time that you just described, is that it went from one that was very authoritarian. I'm telling you what to do. This is what you have to do. Is that, the father knows best model, the doctor is always right model, like that sort of thought. And over time is that culturally, we've gotten more to being able to be active listeners of the process, understanding the needs and the desires of the person that we're trying to treat, and applying the science, which is a wonderful tool to have to better the quality of life in the way that that person would like their quality of life to become better. I mean, it's natural, but that voice and that change in dynamic, I think, has changed with us as a culture over time. But what do you see? I mean, you mentioned some of the new kind of pressures within the field that I find, I mean, A, needed, B, well overdue, and C, as a way to really bring about enhancement to the therapy as far as using a little bit more compassionate care, using neurodivergent firming care, assent-based treatment, making sure that parents and individuals being served have a voice in the process. What are some of the things that you're seeing as the most promising within the field to continue the evolvement and to continue to make us better practitioners as time goes on?
Mm-hmm. What I love to see from the field and what I'm seeing both in the published peer review literature and also at presentations of emerging practices and technologies is that we are really following up with our acknowledgement and importance of these concepts with actions, which I think is one of the most important things. You can talk all day about neurodiversity and affirming care and compassion and assent-based practices, but if you're not actually behaving in accordance to those stated values, then you're not doing anything any better than you were. And so we see progress from action. So what I'm seeing that is especially encouraging and exciting is the development and evaluation of how do we train our field? How do we train aspiring behavior analysts? How do we train existing behavior analysts to engage in these practices? And by the way, what are these practices? What does assent-based care mean? What's that look like? So our field is strong. Our expertise is a behavioral-based approach and defining what the behaviors are. What do they look like? How do we measure them? How do we teach them? How do we learn them? And how do we maintain them over time and in different contexts? And in different contexts, you're also considering cultural implications. So you want to be sensitive to different cultures as well, especially in a field dominated by white practitioners. So what I love to see about the field is the action being taken and demonstrating our commitment. So there's literature coming out that, for purposes of evaluation and controlling the experiment about training and learning these skills, but then there's also research being done in practice, so more applied research demonstrating that we're looking at these needs of our field from various aspects and taking action on them. So that's what really excites me the most about the field. And you're absolutely right. It's critical that we do this. Our field has really not done well with marketing. And you can say, what you want about marketing and get into conversations about propaganda and accuracy of your dissemination, but it's things like this where it's peer reviewed, it's demonstrated and formal and in practice. That's what I love.
Yeah, and I mean, and to have a field where you have so many practitioner researchers, so you're constantly being able to look at the interventions, look at how things are working and make modifications. It's the ability to put that out into public view that gives us the chance to be able to continue to change the trajectory of the field to look at constant improvement. Better is always going to be better every step of the way. And that's how every single field that is industry in this world has improved upon itself, is looking at where are the things that we can start to make changes to make sure that we're always constantly looking to improve. Now, you at and your work at Behaven Kids has really kind of put a lot of impact in trying to be able to create a holistic model of bringing the family along, if I'm correct, is making sure that they're integral in that treatment process. How do you make sure from day one that the family has a voice in the care model, that the family and the recipient is helping to inform the practitioner on how to do their job going forward? Is it a collaborative process?
Yes, absolutely. And just like the work that we need to do, we just spoke about, the work we need to do as a field and improving our best practice approach, it needs to be informed by the individuals who are impacted, period. And that's towards the improvement of the work that we're going to do, and inclusive of training and systems development, but also in our day-to-day work with the individuals and their families. So, one thing that is really important to consider is that ABA services are happening under certain conditions. It's not that you have services being provided 24/7 in every setting in which the child engages. So who's going to be supporting continuity and consistency with their supports after your ABA therapy session? Well, it's primarily the family.
Yeah.
And also schools at times, or generally caretakers. So their involvement is critical, and as well, it's guided by the individual who we're serving, the child. So
Absolutely.
there are a lot of different ways that you can assess their assent. That is, we're talking about assent-based practices and
And I mean, one of the things that I've been seeing a lot, and you talked about building that community, because the community is going to help to reinforce all the skills that the child is trying to learn to empower themselves to contribute in whatever way they possibly would like to contribute, to be a member of every part of the community that they want to be a member of. So in order to do that, treatment has to follow the child. And we've seen in places whether it's a payer restriction where they're saying, no, well, we're not going to allow treatment in this setting, but we'll allow it in this setting. It's like, well, that child is allowed in each of these settings. They're going to have to use these skills in each of these settings. So why wouldn't treatment follow them? And the same thing for practitioners is that they need to create the models of care and empower families to be able to continue to be a part of that process so that the treatment always follows the child in their life. Is this something that you feel like the field is embracing right now? Do you feel like there's more education that has to occur to be able to bring in the educational community alongside I guess, the community services with the clinical work and making sure there's more of this kind of circle of care that's constantly occurring? Is this a growth area that we need?
Absolutely. I don't know any clinicians personally who would not want that to be the case, to be our reality in servicing individuals. And the restrictions, speaking of payers, a lot of restrictions and things that have to be adhered to in that sense. But the limitations I see are more systemic. They're more related to funding. There are not very many states where you can access ABA unless you have an ASD diagnosis. I mentioned earlier, I'm a huge proponent of a public health model, and that is a model of health that acknowledges behavioral health and the importance of prevention and early access to services and supports and resources.
When you're looking at ABA as a field, is that, I mean, the addressable community with a treatment like ABA, which has so much flexibility to it, has a variety of different tools within the toolbox that can be applied. And it's more of a way to be able to kind of create those conditions, those contingencies to be able to develop more and more skills. Is there a flaw in the way that we're looking at treatment right now to say that somebody has to inherently have to have a labeled something wrong in order to access a therapy that's going to empower them so that nothing in the future could go awry? I mean, not nothing, but like you're limiting some of the flaws that might occur because we're not empowering an individual early enough in their lifespan. Is there something that we need to be kind of advocating for? Do families need to be talking about this more to be able to push on the access to earlier care, earlier intervention, and intervention without diagnosis? Because we can't get diagnoses for a lot of kids for 9 months after you even start looking for a psychologist. I mean, are there barriers that we should be breaking down as a field?
Mm-hmm. Great points. I think a lot of what we're up against as a field is more complex contingencies. They're involving government services, more systemic considerations about what kind of resources do families have access to, and it's not just medical professionals who can provide diagnoses or assess for diagnoses, but also to the extent of what does a normal day for a family look like? Are they able to access, with decent comfort, basic needs and things like that. But if you're talking about actionable steps that we can take to contribute to breaking down some of these barriers, or at least mitigating some of these challenges that individuals and families have, absolutely things that we can do. A lot could be done in the context of looking at how you can be engaged with your state developmental services division. The state of Washington is a great model for this. They have a public health model and do a lot of behavioral services for individuals regardless of any diagnosis. So it's a wonderful model, and I think studying how that came to be in that particular state could be helpful. It's a long game. In the meantime, as clinicians, there are things that we can do, and things that we're working on at Behaven Kids is really focusing on the accessibility of services across families and regions where they're needed but not necessarily accessible. So one question that I pose in the context of serving Nebraska, we have rural areas, we have a clinician shortage. A lot of the other systemic barriers that go into building community capacity is, what can I do as a provider of this form of service, as an expert in behavior analysis that can serve these youth and families? Well, I can adjust my model and work around any payer restrictions such that I don't have, it's something that's accessible without really necessitating coverage from insurance. So we have a lot of opportunity to engage with school training, collaborating with their professionals, providing workshops. Thank goodness I can, silver lining of COVID is that a lot of people have learned how to use technology and have become more comfortable with remote services. So I can provide a 5-session workshop for families who are struggling with bedtime routines or struggling to identify why their child's engaging in these behaviors that are impacting the kids' quality of life. Toilet training workshops, so I can make a meaningful impact by inserting myself at a lesser dosage, so to say, than full-time or part-time standard ABA services that are covered by insurance.
Well, Dr. Funk, it sounds like you laid down the gauntlet, is that we've all got to tackle the geographic, the socioeconomic, and the cultural barriers right now and figure out models for care. And quite frankly, I think that's a wonderful goal for us to start looking at, because those are underserved populations, and that's who we should be trying to figure out how can we service the totality versus just the minority of individuals. I can't wait for that longitudinal study to come out of Washington, just to be able to kind of see, did we prevent some things over time where that ends up being cost effective? And if it's cost effective, then you got more government buy-in. So we'll see what happens there. But so where can listeners get more information from you and be able to learn a little bit more about how to be able to incorporate some of these new changes and techniques into the systems of care that we're talking about?
A great landing page would be behavenkids.com. We have a blog on there. I write some posts, collaborate with others on some posts that are pretty accessible and digestible to families who have a variety of different questions or concerns. Again, really emphasize the CDC website as well. Our team is presenting at a conference in a couple of weeks, the ABAI conference, Association for Behavior Analysis International. So we're talking about the work we're doing that merges compliance, state payer regulations with quality of care and a business model. So it should be a really interesting and engaging conversation there. But yeah, our landing page at behavenkids.com is a great starting point.
It sounds like there's resources for clinicians and for families out there, and attending that ABAI conference and listening to your presentation, I think, will be extremely informative. But thank you so much, Dr. Funk, for joining us today and sharing your expertise.
Well, thank you so much for having me, and thank you for the work that you do to disseminate important and accurate information about disability services and advocating for equality and quality care and supports for them. So thanks very much for the work you do and for having me here today.
Much appreciated. Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.